Hi, I'm Dr. Christopher Goff at Dent Art Chicago, and I'm here to answer a couple of questions for you.
Hi, Dr. Chris. What are dental fillings?
So dental fillings are a replacement for decayed or broken tooth structure. So we clean out the tooth, we open it up, and then we fill it in. So we replace that missing structure.
Can fillings be avoided?
Fillings absolutely can be avoided. We're trying to avoid any tooth decay in general. One of the biggest things is a sugary diet or not having good oral hygiene. So trying to avoid as much sugar and brushing your teeth twice a day and flossing, all of these things help prevent cavities in the first place.
Can dentists do tooth filling without drilling?
Dentists can do fillings without having to do any drilling, but it really depends on the filling specifically. More often than not, it is required to remove some of that decayed tooth structure.
What are the different types of filling in dentistry?
So the old school stuff is the amalgam or the silver fillings that you see. And those are fantastic, but they're not as commonplace anymore. And now we often use resin composite fillings. So it's a light cured polymerized filling material that's white and it's tooth colored.
Can my dental fillings match my tooth color?
Yes, it can. We have multiple colors of this composite material, so we can make it look as natural as possible.
Does a dental filling procedure hurt?
It does not hurt. There is an uncomfortable moment at the beginning when we get you numb, but once the tooth is numbed up, you shouldn't feel anything other than a little bit of pressure.
Can I brush my teeth after getting a tooth filling?
The nice thing about these resin composites is as soon as we are done curing them, you are ready to go. You can brush your teeth, you can eat. The only thing we ask is that you wait until you can feel your lip or your cheek again, because you will be numb and we don't want you to accidentally bite yourself.
Do dental fillings need to be replaced?
Sometimes dental fillings do need to be replaced. So between the tooth and the filling, there's a space where we put bond so that it actually holds in place. Sometimes over years that bond breaks down or fillings break and there can be cavities around or underneath that filling. So that at that point, yes, they would need to get replaced.
When should I schedule a dental appointment if I think I might need a filling?
If you think you might need a filling, if you're feeling any sensitivity, if you see something, schedule an appointment for as soon as possible. Otherwise, we like to see patients come in every 6 months just for regular checkups, just to catch things before they're too deep. It's much better to get things done before they're a bigger problem.